Welcome everyone to the Ostomy and IBD live show. This is where we get to talk about all things about having an ostomy, to Crohn's disease, colitis, and really touching on different subjects from the physical to the mental to the emotional issues. So I am Elaine O'Rourke. I'm your host here every week. I had Crohn's disease, from which I ended up getting an ileostomy 15 years ago. So now I actually work with people one-on-one to help them more with the mental and emotional issues, and to work from going from being in survival mode to really thriving in your life through my ostomy program. And with my program for people with IBD, we look at different ways to really manage gut health, and again, working with a lot of the mental and emotional issues. So this week's topic is really more for people with ostomies. It's about ostomy output challenges, and my guest is Nurse Anita, who I'm delighted is joining me again on this show. But first of all, if you are tuning in, you know that I love to get your questions, your comments, see where you're tuning in from. So get interactive, put your comments in there. Also, if you are on YouTube, if you are a YouTuber person, if you could subscribe, that would be super. And it's always really helpful to get a little thumbs up. So on YouTube, I'm Elaine O'Rourke Yoga Ostomy IBD. On Instagram, you can follow me on Elaine O'Rourke Yoga. And on Facebook, it's under Ostomy and IBD Life. Let's go ahead and bring in Nurse Anita. Add her into the stream. Hi, Nurse.
Hi, how you doing?
Doing awesome.
Got my fan club. You know, no real people. Ooh, he got a nice hiney. Anyway, thank you so much, Elaine. You know, Elaine is so great, and she can be such a help to people who are especially new and old to just deal with all that stuff you go through, because I'm an ostomy nurse and I'm the stoma whisperer, but the emotional stuff, I can only go so far. You need somebody who talks the talk, who walks the walk.
Oh, thank you, Nurse Anita. And I'm like, so you were my first guest on this show.
Thank you. Yeah, glad to come back.
And on that episode, we talked about leaks and skin adherence problems. But this week, we are talking about our different ostomy challenges with output issues. So, you know, I only know, I mean, obviously when I'm working with clients, I learn a lot through them, but like really helpful because there's, you know, so many different problems that people face and, you know, aren't sure what to do about. So, let's get right into it like we like to do. Okay, let me see if I can bring up the chart here. Okay, this is the Bristol stool chart, everyone. Excited.
Yeah. So we're going to let's talk about poo, baby. Let's talk about you and me. Let's talk about all the good things and the bad things. Ostomy. Let's talk about poo. Okay, so the Bristol stool chart is a real thing. This is not just a cartoon. It's how they describe poop on type 1 to type 7. So you can look at this and say, I think maybe I'm a 5. So this is how I'm going to start talking about poop challenges. So we're going to go through each type, and I'm going to show you some tips and tricks on how to manage that. And again, I am not living with an ostomy, but I teach people, and hopefully, and I learn from you all, and hopefully some of the things I'm going to tell you are helpful. So if you have type 1 poop, you are constipated. If you're pooping pellets, little rabbit, beads, you need to drink more water and increase more fiber. And I'm sure you probably have a colostomy. The type 1, 2, 3, and 4 are generally going to be your colostomates. And those are diversions that are on the left side of the belly and do absorb water in the colon. And the type 5, 6, 7 will go in are more of your ileostomy patients. So type 1, increased fluid. This is actually really easy to empty because they're just little pebbles. Type 2, we're getting kind of still hard poop, and that might actually even hurt coming out of your stoma if it's that hard. And, if you were constipated before you had an ostomy, chances are you're going to be constipated again. Type 3 and 4, we're getting into kind of mushier, more formed stool. And in between that area and type 4, we get into the mushy pancaking stool. Okay.
Okay. So, can I interrupt for a second?
Yeah.
Since we are talking about mushy pancaking stool, can you explain to people, because this is more something that people with colostomies have. I haven't heard of that with Ileostomy.
So yeah, it's not this what I had for breakfast, trust me. But it is, people talk about it, it's when stool accumulates around the stoma and doesn't want to fall into the bag. And I actually have a demonstration here I did. And also, when you have a colostomy, if you're only emptying your bag once or twice a day, you should be using a closed-end pouch. Because let's face it, nobody likes squishing poop, okay? It's really high on the yuck factor. When you have an ileostomy, they don't have to squish it much. But I always recommend a closed-end pouch. So here's somebody with a closed-end pouch. And what I did is I got a kid's toy, and I put it under. And so that would be like your pancaking. Okay, you see the face? It's one of those things, one of these plops. And this is what you would like take off your closed-end pouch, and you'd be left with this. And again, it's not great either. So what do people do? Well, one of the things you can do is you can put some lubricating deodorant in your pouch. And here's a little nascent, and I'm not advertising for them or anything, and just put it right on the inside of the pouch here. So it might help slide down easier.
So someone would put that in before they're putting
they apply the pouch.
Yeah.
Because really, they're going to remove the pouch and toss it, and then they have to take away another one.
And then can I ask you, if someone has an open-ended pouch, would they put that in when they are changing their appliance?
Yeah.
Can you put it?
If they're using a drainable pouch, I would always recommend using some sort of a lubricating deodorant to help the stool come out easier.
Oh, okay, great.
Yeah. Right. Yeah, that's really good. And it also deodorizes as well.
Oh, okay, great. And then in regards to, I do just want to say, I know that you recommend the closed end pouch. Mm-hmm. I don't have a colostomy, but the one drawback that I can see to that is that you are then quite limited, or like if you, at the moment, we're not all out and about, well, it depends where you are in the world, but the reason I personally wouldn't be advocating for a closed-end pouch is because I would find it personally really limiting if I had to take that off to empty it, rather than just finding a bathroom and emptying it into the toilet bowl and then it's gone. So for me, that would be like, oh my God, I have to have stuff with me all like a lot of the time. So just, when people are thinking about their appliances, if you're not someone who's, out of the home a lot, that might be something to do, but then you also have to think of a lot more disposal of the actual bag.
Again, it's a personal choice, but really they're just going to remove the pouch, put it in a black Ziploc bag and toss it and put on a new one.
Yeah.
Okay. But again, so I wanted to talk about two other things with the closed-end pouch. Mm-hmm. Okay. This is a one-piece closed-end pouch where you would simply apply it to your skin. Okay. And then when it gets full, just take it off and apply a new one. And a lot of people say they're very concerned, well, you'll be putting this on my skin all the time. It's very gentle. This type of pouch is very gentle. And I think it's lower on the yuck factor because when you have the barrier, you have to clean the stool off to put another pouch on. So I always advocate for just plain one piece, closed end, remove and toss. And this is also really important for people who are caregivers as well. The other thing that might help reduce pancaking is to use a convex barrier, okay? One that makes more of a bowl shape and pushes your stool out more. A lot of people say that this really helps, and belts also help too, pooch the stoma out. Unfortunately, a lot of people, you're still going to have to just push it down during the day. When you're upright, definitely tends to pancake when you're laying down. So if you could stand up, you know, or sit up, that really helps as well.
Yeah.
And filters. Let's talk about filters. A lot of people have filters on their pouch. Okay. Sometimes these filters work so good, it makes a vacuum. Okay. It makes a vacuum in the bag, and the stool needs a little bit of air in the bag to help it to drain. So I always recommend when you put it on, blow in the bag a little bit, make sure there's a little bit of air in there, and then it should be fine. So always make sure that there's a little bit of air in the bag. And on the other hand, lots of people, 1 second, looking for a little prop here, say that the bag works too good. So they put the little cover over it. You know, those little covers that come in the pouches with this, and they put that over it to stop the filter from working, and then just release the gas as needed.
Okay.
Or you might choose not to do that.
All right. So that would be if someone is finding that their bag is filling up a lot with air.
Yes.
That you would cover the filter.
No, if it gets like a vacuum, it's like sucked in.
Oh, I see.
It has, has no air in it. But now they're going to be passing gas through their stoma, as you probably do too. But
okay,
sometimes the filters work too good.
All right.
A lot of people say that makes a vacuum, and that makes the stool, sit tight on the stoma.
Oh, okay, cool. Yeah, because personally, I think I probably tried filter at some stage, and I didn't find that it made it different for me. That was so.
But you don't have formed stool.
Yeah.
Right. So that's the big difference. People with formed stool and people with loose stool.
Right.
So, do you have any more questions about the 1, 2, 3, and 4s?
I don't know. Yeah, because I think they definitely are more, because I don't even relate to them having an ileostomy. I'm like, what? There's formed.
I know. And take it off, peel it on and take it off. The other disadvantage too is that it's not very green for the environment.
Yeah.
So the other thing people can do as well, that's another option, is use the Magic liners. I don't know if anybody's seen these.
Yeah.
So this is great for caregivers. Okay, so you would basically put this inside the pouch and then remove the pouch and toss.
Right.
So.
Another thing, and another reason maybe to have an open-ended pouch is just the amount of bags that you go through, and depending on what your insurance actually covers, that's something that people run into. And if you are finding that you're having a lot of skin problems, then I would go to an open-ended pouch so that you're not pulling things on and off so much. The colostomy. If you have an ileostomy, please make sure you have an open-ended pouch, because I hear of people that don't, and I can't even imagine what a nightmare that would be. So, so should we go back to the chart, Anita?
Sure. Okay.
Let's go back to the chart and see what other types we have on the Bristol stool chart.
I think this is hysterical. I mean, really, it's kind of comical, isn't it? I mean, and then I have a poop emoji, So on 5, 6, and 7, let's talk about ileostomates. Okay, so ileostomates have pasty, like toothpaste consistency, down over to watery. So most ileostomates, they say empty 4 to 6 times a day, but I think that also depends on how much you're eating and drinking, and also what your absorption is like.
Right.
So it will vary. You know, if you're emptying 10 times a day, you know, you might want to call your doctor.
I empty, from my own experience, I empty a lot, but I also like to, if there's anything in there, I will empty out, but I definitely at least 6 to probably 10 times a day.
Okay, but if, you know, and again, here we go. Are you emptying it when it's this full, or are you emptying it when it's this full?
I would never let it get to,
right.
Never let it get
These are personal choices. These are personal choices. I always recommend empty the bag when it's at, you know, no more than half full.
Exactly, and I'm going to just a moment, Anita. So for people, like, try, and if you're new to this and you have an ileostomy, I definitely try to recommend emptying it when it's like is half full. Just go empty it if you're near, because it's going to, the fuller it gets, then you might run into problems with leakage. Right. It just gets heavy, it pulls on you, so it's just going to feel better to get rid of it, empty it out, and then think better again.
And if you are the type of person to let it get heavy, you definitely might want to consider a belt. That'll give you a little extra support. But again, everybody's different. So look, so the ileostomy stool tends to be kind of, you know, mushy. It usually empties easily. If you have issues, you know, with things sticking, again, you know, use your lubricating deodorant. And, you know, if you're seeing your poop, seeing your food in the poop, chances are you're not chewing your food well enough. So
that's really important, and we brought that up last week as well, about J pouches, and just across the board, if you have a J pouch, if you have an ileostomy, if you have a colostomy, make sure you chew your food really well, and also keeping yourself hydrated. Right. Speaking of hydration, can you talk about like high output people?
Yes, that's the next. The number 7, when they're having watery output. Okay, and you might just have a bout of diarrhea, but some people have high output or ileostomies and short bowel syndrome. Okay, so people who have that condition, they empty 20 times a day, a lot, and it's watery. So this kind of pouch is really not going to cut it for them, and definitely they would never be in a closed-end pouch, never in this. So we try to get them into something like this, a high output pouch.
Wow.
This is by Coloplast. This holds up to half a liter.
So I've never seen that. Now, is that more?
It has a plug type closure. Okay.
Is that something that people with urostomies would?
No, a urostomy pouch is much smaller. A urostomy pouch is basically the same, you know, the size with a little spout.
Okay, but if you, so sometimes I hear people at nighttime putting on a bigger bag at nighttime.
Yeah. So here is another one. This is the Convatec brand, and I don't think this one holds quite as much as the Coloplast. And the other great thing about these bags too, if you really, you know, if you have to empty this like every 2 hours, you're not sleeping.
No.
You're not sleeping unless you're sleeping in a wet bed. So they make fecal drainage bag, hang it on the side of the bed, connect, and sleep well.
So for people with all types of ostomies? Obviously not a J pouch, but would that be something for someone with an ileostomy, colostomy, urostomy?
No, just ileostomies.
Just ileostomy. Okay.
Just ileostomies. High output ileostomy.
Okay. And so just for people who are listening and watching, what's that called again?
A high output pouch.
That's a high output pouch with the drain coming off of it, so that you
and all the manufacturers make it.
Okay, great. So that would be really useful, I would imagine, for many people.
Yeah.
Let's jump into our comments and just see if there's any questions so far.
Sure.
All right. So I'll pop over here. Hi, Justin, and a shout out to Justin because he's always helping me with promoting the show and letting people know about it. And yes, of course, this is true. Ostomy Nurse Anita has a great personality. We know that. I did promise that this would be entertaining and fun. And Sarah says, love it, plop. Always informative, and Bella. Let's see. Derek says, I've never had a filter that worked yet with my I empty it 4 to 5 times a night. I only use one that empties at bottom. Do you have any suggestions about that?
I would definitely consider getting a high output pouch. They usually, they're all 2-piece appliances. I would call your manufacturer and ask them to send you a sample. Hollister, Convatec, Coloplast, they all make them. But I do want to say, and the filter, I don't know if you need a filter. Convatec has a filter, and check this out. This one is plastic. It comes off. And then inside here is a charcoal filter. So they give you extras of these, or you can buy extras of these to put over the opening. Let me show you the opening. Okay. Back off. Okay. So this is the filter. So this is a real hole filter, not like the other bags that have this we don't see it. So for ileostomates, your poop will come out of this hole if you stand on your head, definitely. So I don't recommend headstands while wearing this pouch, but just also laying down.
Well, that is something that I never want to wear because I'm always standing on my head or standing on my hands.
Are you?
Yeah. Did you?
That is so cool. I only stand on my hands in the pool. But so they send you extra filters. But hey, if this would help you get a good night's sleep, that would be awesome.
Yeah. Okay, Derek, give that a try.
Is the 6th vital sign. Without sleep, you lose so much.
So Derek, if you try that, please send me a message and let me know so that so that you can just let us know. I'm always interested.
Yeah.
So let's see, Lenora, I'm going to bring your message in here. I have high output. I empty about 10 to 12 all day, suffering from dehydration. Yes, I tried a high output pouch, but didn't like it. My poop varies. I wonder, Lenora, if you're still watching, if you can maybe type in why, what was it about the high output pouch that you didn't like? If it was because I'm a pretty small person, it looks really cumbersome, heavy. But if you want to type in what about it you didn't like, okay.
And I have an answer for that too. All these bags this is a Convatec. So sometimes if your stool gets a little pasty, you'd be squishing. So they do make a clip. So you would just cut off the tail and just roll and close with a clip.
Oh.
Clip. Yes. So that's another really good tip. And when it's heavy like this, I definitely recommend getting a wrap. an ostomy wrap to hold it and support it. And I would wear it a little sideways. I wouldn't wear it straight down.
Right.
So that's my other tip there.
Okay, cool.
And you know what though too? Coloplast is the only one that makes the bag, the attachment bag.
All right.
The other ones don't make the nighttime poop bag.
Oh, okay, good. So yeah, Lenora says, yeah, I'm very short and found it uncomfortable. Yeah, I would the same.
Get a wrap.
Yeah.
There's plenty of them out there. There's some cheap ones on Amazon too.
Mm-hmm. And you can also, what I do, I mean, I actually use, I don't have a high output problem, so I'm able to thankfully use the mini pouches, but I often just, just kind of tuck it up and kind of, so it doesn't feel so heavy. So I would definitely try and get something, like Anita was saying, get a wrap or something that kind of holds it in so you don't feel like it's pulling down.
Yeah. Oh, I wanted to say one other thing. How are we doing on time, sweetie?
We're doing all right. We're doing all right. And Derek says, thank you. Some good info. So yeah, Derek, definitely let us know how that rolls.
Oh, here's one of the little filter covers. They look like little milk bottles.
Oh.
It's funny.
Mm-hmm.
Yeah. So I also wanted to talk about if you just generally have kind of watery stool and you don't really want a high output pouch, but you don't want it sloshing around or something. There are these pearls, and this is made by Trio, and all the manufacturers make them, and you drop this in your pouch and it sort of explodes and turns your liquid poop into mushy poop.
Wow.
So, and that might be something really great to use at night, so at night you don't have to get up as much.
Right.
Or when you're flying or when you're running.
So
turns liquid into gel. And you don't open you don't open these sachets, you just drop it in whole.
Oh, okay, just goes in. Oh, okay. I would definitely have been trying to open it like a sugar.
No, you just drop the whole thing in. Yeah.
Okay, cool. I think that might have come up in last week's episode about them, especially for flying. So I would imagine for a high output liquidy that they're a good product to have. What's it called again? Pearls?
This is called Ostomy Pearls. They're absorbent gelling sachets. So you'll see them and these are, I believe, are covered under your insurance. Mm-hmm. Gelling sachets,
mm-hmm.
what they're called, gelling. Convatec makes them too. All the big boys do.
Do you find when you've been interacting with patients that people, obviously, if you're having high output, like Lenora said, you're going to run into dehydration problems. Do you have any specific products that you like for dehydration? I mean, I know there's the sachets that I've used before, and I've used Pedialyte.
My biggest recommendation is to not drink water. Drink anything else but water.
Why?
Water makes you poo more and get more dehydrated. It's a really strange thing. It's hypoosmolaric, and when you have high output, you can drink salt water, lemonade, iced tea, Coca-Cola, you figure out what's best for you, but water is, not good. My best option would be Pedialyte.
Mm-hmm. I know the last time I've been so fortunate. I've only had like 2 incidences over 15 years. One time I had to get IV hydration. And then this time I kind of caught it on time, but I remember drinking the Pedialyte because anything else to me, just when I was like so dehydrated, tasted awful. Like
I think there is a product out there, H2O ORS. There are some, like the little iced tea things. When I find that, we can add it to the list. I'll let you know what that is.
Yeah.
One other thing too, I wanted to mention when people have high output ileostomies or, every time they go to change their bag, their ostomy starts pooing. It can be really challenging. You know, I always say, if you can, just get in the shower. But lots of times you really can't, you know.
Mhm.
So I don't know if you saw the video I did. This is a stoma genie. And you could basically, this has a little cotton filter inside it. And you would basically hold this over your stoma and it would capture the effluent and give you the chance to, you know, capture the poo and put your pouch on.
Yeah.
Hopefully, you know, so it takes a little work, takes a little practice. Two-piece definitely is easier, but you know, that's really the most distressful thing for people is to be pooing uncontrollably. Definitely get in the shower.
Yeah, I mean, there's nothing worse than, and especially when you're not planning it and you have a leak and it's just like going everywhere.
Right.
So that's what's the name of the product again? It's Stoma Genie?
It's a Stomagenics capture cartridge. They're
Right.
calling it a capture cartridge.
Right. And, you know, I think we discussed in the first episode that we did together, you know, there's lots of different homemade ways to.
Yeah, you can use an old toilet paper roll. It's great too. And just cut it and size it to your stoma, stuff some toilet tissue in there. Yeah, do that. You can do that too. You know, anything, but you know, also for ileostomies, a lot of people eat marshmallows before they change.
Yeah.
They say that really helps. Peanut butter. I do recommend to people, you know, don't eat or drink for an hour before I see them because I don't want them pooing. Like, as much as you think I love poo, I don't like it when you poo on me. Okay, so there.
So yeah, personally with me, I know like I try to change it in the morning, usually after I've been up for a little bit. So I haven't eaten since, you know, whatever time I had dinner the night before. But definitely really, I do remember one of the first times when I was going in to see my ostomy nurse for a checkup, and I hadn't even figured out food or anything yet. And I went in, and I think I'd eaten before I went in. And she was like,
and you pooed all over.
I didn't even think about it.
And you didn't even give her she didn't even give you consent.
So just going back to the comments here. So Lenora says yes, that she uses V8 for hydration. That's a great thing.
V8 is good. Tomato juice is excellent. Yeah.
And Casaria is saying that she likes the drip. Oh yeah, drip drop is the name of it.
Right.
Hydration.
Mm-hmm.
And Sarah from Happy Healthy Humanity just is saying just so good. She loves Nurse Anita. Yes, I do love Nurse Anita.
Thank you. So good to be here.
So I have a question in regards to are there output challenges for people who have urostomies?
It's again with I pee all the time, and I pee all the time. And so, that's so hard because, you know, as you all know, your skin has to be dry for this barrier to stick. If it is not dry, it will not stick. And when you pee, you can't see pee really well like you do poop.
Right.
It's clear. And it's very insipidous, and it just sneaks under there, and next thing you know, it falls off in 2 hours. So, right. That's the trick, and that's where this is genius for the pee. And the guy who invented this, he had a urostomy. He was a very industrial man, and he created something out of PVC piping. Yes, he was like an engineer. So now his family has taken over the business, and they're trying to really, you know, make this work for other people.
Yeah, that's
and awesome. Make it more hygienic, because you know, really, this is a very we call it in Europe. You'll see they call it intimate hygiene. So there's not many nurses like me that can do this.
You are a special.
Makes a special person.
So anything else that we haven't covered? I think we got through everything. Any other considerations? Or if anyone, I'll just check in in our chat again. If anyone has any questions or comments. Any?
Uh,
I think we managed to get.
we got through a lot.
Yes, we did. We did.
Very exciting.
So I didn't see any more comments. Lenora says, oh yeah, it's V8 hydrate. So if anyone's watching this and you're wondering V8, what V8, she suggests the V8 hydrate, which is just for dehydration, and the blueberry flavor is sounds good. I'll just pull that up on the
screen.
Yes.
There.
Yeah. Great.
Thanks, Lenora.
Thank you. Thank you.
We're all learning.
All right. So Nurse Anita, your website, let's bring it up here so the folks, oh,
and I do private consulting. So I can video cut, Skype, Duo, Messenger. So I can do video consults with you one-on-one. Basically, very inexpensive, $25 for the first 15 minutes and $1 a minute after that.
That is a bargain. So yeah, definitely check out AnitaNurse.com.
Yeah.
In touch with Anita, and as you can tell, she is a very fun person to work with. So thank you, Anita, for joining me again this week. We'll have you on again in the new year. I try to remember to say, if you are watching this after on the replay and you have questions, then put them up, because we keep on checking the comments. So, if you have any questions, we'll try and get you some answers. So Nurse Anita, enjoy your pancake.
I'm gonna have my pancake now.
And we will talk to you soon. Okay, so thank you everyone for joining me. Make sure that you go onto my website, grab the free download that I have for people with ostomies, overcoming 3 simple ways to eliminate fears around your ostomy. And for people with Crohn's colitis, I have hidden causes, 5 mistakes even well-informed people make with IBD. And that's on my website, ElaineO'Rourke.com. Next week, I'm going to be arriving home in Ireland. I'm going home for, I don't know, indefinitely for a couple of months anyway. So next week, Thanksgiving here in the States, there will be no show, taking a week off, and then I will be back again the first Tuesday of December, and I'll actually do a show about travel and my experience with traveling with COVID and how that all goes. And then I have some really awesome guests for December coming up. If you are interested in doing yoga with me, yoga for people with ostomies, Crohn's colitis, then check out my website, get in touch, because I have a series that will hopefully start in January. And of course, if you want to work with me one-on-one, then send me an email or just DM me, and we can get in touch and discuss from there. So in the meantime, until I see you in December, take good care. For people in the States, enjoy Thanksgiving, and I will see you next time. I'll be in Ireland at my mom's house. We'll have a new setup. All right, thank you everyone. Keep the comments coming. Make sure to give me a subscribe on YouTube, or check me out on Instagram, and of course follow me on Facebook. All right.